Hi, many people suffer from lower back pain or neck pain. Most of the time, it may be due to just simple muscle strain, and it usually will resolve with some medication and physiotherapy. However, if the pain is persistent, chronic, recurrent, then you should think of other possible causes of the back pain. Typically, back pain due to underlying pathology may be aggravated when you stand for too long, when you walk, or even when you lift heavy weight. Sometimes even coughing or sneezing can aggravate back pain. It is also important to understand if it is just back pain alone or is it associated with neurological symptoms such as radicular pain down the legs, numbness, or even tingling. And in some severe cases, one may experience loss of sensation or weakness either in the upper limbs or lower limbs, depending on whether it's a cervical issue or it's a lumbar issue. Now, typically, many of us may suffer from mechanical back pain or neck pain, and that is when you load the neck or the back. So, typically, there is a disc lying in between the spine, and the disc is subject to degeneration, and due to wear and tear, this can cause a bit of mechanical pain. You also have facet joints which are lying at the back, and this typically can get enlarged due to arthritis, and typically you may have pain when you go backwards or forwards. Now, if the pathology of concern may be a disc prolapse or an enlarged facet joint, if it is significant, then it can potentially cause some degree of narrowing in the foramen where the nerve is passing through. And this will then typically cause nerve symptoms where the nerve is being compressed, and one may experience some kind of impingement resulting in radicular pain or numbness, typically also known as sciatica if it's very severe. Therefore, whenever you are having significant neck pain or back pain which is not getting resolved, then it is prudent to get a thorough clinical examination, and often you may need an X-ray and an MRI to diagnose the problem of concern. Many of these issues can be treated in a holistic approach with medications, physiotherapy, lifestyle modification, and adaptation. If the problem is arrested at the initial stage, then you can prevent complications such as neurological problems, which can often become permanent if it's chronically impinging a nerve. Therefore, take precautions whenever you're doing normal activities, and always try to practice physiotherapy and simple back care advices for the neck and the lower back. And if you are symptomatic and if it's persistent and chronic, get an early consultation to diagnose the problem of concern. Thank you.